Good morning to you all. I'm Dr. JP Singh. Welcome to our channel. Today we'll be discussing few MCQs. Let's go to first MCQ. It says the difference between medical negligence and medical error is primarily based on. The question is asking the difference between medical negligence and the medical error. And the options are character of outcome, fatal or non-fatal, level of skill and knowledge of the professional, intention to cause harm, and presence of recognized complication. So, actually, we should know what is medical negligence. Medical negligence, as it says, it is the failure of the medical professional to meet the standard of skill and knowledge which is generally expected from the individual with that experience and that qualification. If the individual is not having that skill and care, not giving that skill application of his skill and care to the patient, it is in the present situation, it is known as medical negligence. So option A says the character of the outcome, fatal or non-fatal. With a case being non-fatal, it may be negligence if the doctor is not applying proper skill and care to the patient and leading to harm to the individual. In such case, it may not be fatal, but it is negligence. And option C says intention to cause harm. Any doctor who is having any intention while treating his patient to cause harm to the patient, it is criminal negligence. And the punishment is different for that. It will be tried in criminal court, whereas medical negligence, it is tried in civil court. So, and the last option says presence of recognized complication. The complication in any case, it is always associated with the procedure or with the disease. So the presence or absence of any complication does not rule out or add to the medical negligence or medical error, but it is the level of skill and knowledge of the professional, which if not applied in the present case, it leads to medical negligence. So the difference between medical negligence and medical error is primarily the level of skill and knowledge of the professional, not the other option. Moving on to second question. The most commonly used system for age estimation in children is. So it is asking, the question is asking about age estimation in children, right? Not in adults. And the options are de Meridian's method, Gustafson method, Keval method, and Lemondin's method. As we know, the Gustafson method, we all know it is based on estimation of 6 criteria and it is for the age beyond 25. That means it is for adults. Various criteria for Gustafson method, they are uh, root resorption, secondary dentin, periodontitis, and 3 more. If you want to know the complete Gustafson method, either you can refer to the books or you can comment in the comment box. We'll discuss Gustafson method. And Keval method, it is for adult age estimation. It measures the ratio of tooth with the tooth pulp by X-ray examination. So by X-ray examination, the ratio of tooth pulp with the tooth material in adults. Keval method is used in adults. And Lemondin's method, it measures the periodontal recession with translucency of the root in adults, again in adults. So Lemondin method, translucency of the root with periodontosis. Keval method, it is the pulp of the tooth with the tooth material on X-ray. Gustafson method on 6 criteria in age group more than 25. So the last option we are left with is Demirjian's method. It is the age estimation done in children by orthopantogram. Radiograph or X-ray is taken for the mandibular tooth and tooth are given marking from A to H starting from incisors to the molar where the last molar it is left behind. It is not calculated in Demirjian's method. So we take the X-ray, give the marking from A to H and with the marking we calculate the total scoring of the teeth in the lower jaw. So it is the answer, Demirjian's method, to calculate the age of child, right? And the next question is postmortem change which helps to distinguish postmortem hypostasis from bruising is fixed discoloration, pressure pallor, color shift on glass, slide test, and blanching under finger pressure in bruising. So we know what is the cause for hypostasis. It is accumulation of blood on the lower area of body when it is lying in that position for long after death of the individual, whereas the bruising is because of accumulation of blood due to rupture of vessel in subcutaneous tissue. So fixed discoloration, it is not the reason, because bruising, it leads to bruising. If we keep on looking at the bruise over a period, it is the color change in the bruise, whereas in postmortem hypostasis it also changes color from the initial stage to the later stage. Pressure pallor, because of pressure pallor, it is because the pressure pallor is absent in bruising. In bruising, it is the coagulated blood which is fixed in that area, the coagulated blood which is fixed in that area, and hence it will not go into a pallor situation on pressure. The next is color shift on glass slide test. It is the answer of this question, because in the postmortem hypostasis, we check the postmortem hypostasis by applying pressure in that area, and it goes into a pallor state. It may be pink or deep pink depending upon the cause of death. But when we apply pressure on that area in hypostasis, it becomes pallor in that area. It is one of the main tests which is differentiating feature between the postmortem hypostasis and bruising. And the last is blanching under finger pressure in bruising. It is present in postmortem hypostasis because it is present over all the areas which are present due to pressure on the dependent position, right? Next question is 30-year-old postpartum female found depressed, unable to take care of her newborn, expressing thoughts of self-harm. It's a case of postpartum blues, postpartum psychosis, postpartum depression, or reactive psychosis. Postpartum blues, they present with same situation, but they are of very low degree. Depressed, unable to take care of the newborn, expressing thought of self-harm. This thought of self-harm is absent in postpartum blues. It is totally absent in postpartum blues, whereas in postpartum psychosis, it is a severe form. Postpartum psychosis is a severe form. It is found in postpartum females where there are delusions and hallucination to variable degree present, and individual may try to commit harm to the self and to the baby also. So the features in the postpartum psychosis, hallucination or delusion, and other features, they are not mentioned here. It is not the answers. It is not the answer. And postpartum depression, it is the answer for this question, because it is depression is present, depression in the patient, right? Along with care for unable to take care for newborn and thought of self-harm, along with few other features like feeling of worthlessness, uh, and persistent sadness in the individual, and fatigue. They are seen in postpartum depression, right? And reactive psychosis, it is the reaction of the individual to some external stress factor. So the answer in this question is postpartum depression. Moving on to next question is 35-year-old female presented with sedation and hypotension after ingestion of unknown pills. The symptoms are sedation and hypotension. On examination, signs are bradycardia, constricted pupil, and respiratory depression. The triad of bradycardia, constricted pupil with respiratory depression, it is asking about in which poisoning they are found. Tricyclic antidepressants, opioids, benzodiazepines, or beta blockers. So for beta blockers, bradycardia is present, but along with hypotension, but there is no meiosis or constriction of pupil. It is ruled out. Beta blockers, benzodiazepines, sedation is present. It is true, sedation is present, hypotension is present, but there is no respiratory depression. In benzodiazepines, there is no respiratory depression. In beta blockers, there is no meiosis. And then tricyclic antidepressant. In tricyclic antidepressant, they present with pupillary dilation. Pupillary dilation, they present with pupillary dilation. So the option left is opioids. In opioids, we have the triad of bradycardia, constriction of the pupil, and respiratory depression along with sedation and hypotension. So to rule out tricyclic antidepressant, we have pupillary dilation. For benzodiazepines, we have no respiratory depression, and for beta blockers, we don't have meiosis or pupillary constriction. So the answer is opioids, right? Moving on to next question. In forensic medicine, manner of death is best differentiated from the cause of death as the manner of death describes the physiological process while the cause of death explains the intent. Manner of death focuses on the external circumstances while cause of death addresses the chain of events leading to death. Manner of death includes a sequence of events in pathology, while the cause of death completely describes the psychological context, and both terms are synonymous. To understand the difference between manner of death and the cause of death, it is important because we are dealing with the legal documents. For example, the death certificate. It is very important document. That is why we should know the manner of death and the difference from the cause of death. Right? The manner of death, it can be categorized as accidental or suicidal or homicidal or natural or undifferentiated. A very important part of the manner of death is undifferentiated, and it generally involves the external factors. Whereas the cause of death, it is the pathophysiology or the damage to an organ which leads to the final event of death. Right? In this, the manner of death describes the physiological process. It is not the physiological process, but the external factor which is acting on the body and leading to the death finally. And in C, the manner of death includes the sequence of events in pathology. Sequence of event in pathology under manner of death and psychologically context. It determines the cause of death, right? And both terms are synonymous. It is totally wrong. The manner of death and cause of death, they are different terms, should be treated differently, and they are not synonymous. So the answer in this question is the manner of death focuses on the external circumstances, while the cause of death addresses the chain of events which leads to the death finally. As mentioned, it may be because of sepsis or MI or some other factor. Right? This was all from my side. If you have any doubt, please comment in the comment box, and if you want any other topic, please mention in the comment box. We'll make a lecture on that and discuss that topic. And please subscribe, like, and refer our channel to your friends. Thank you.